Hi everyone, my name is Yi. I'm your host for Occupational Medicine Pearls podcast. Previously, I was talking about non-ionizing radiation, and I'm supposed to do another episode on ionizing radiation, but it has to wait since I'm reading Ergonomics hazards. So I thought I want to start with that first, and then I will come back to ionizing radiation. So I'm reading through my notes, and this is kind of like me revising what I'm talking, so it may be a bit all over the place, but bear with me. So ergonomic hazard or design hazard are among everything that we do rather than under one theme in our training curriculum. So that is included in many different domains, and we need to consider that. What is ergonomics? Ergonomics is a discipline or a scientific discipline. They concern about understanding interactions among humans and other elements in a system, which is our environment, and it involves theory, principles, data, and methods to design in order to optimize human well-being and overall system performance. When these interactions or systems do not work, ergonomic hazards arise. Generally, there are three main domains, recognized domain. Now, they are easy way to remember them: physical ergonomics, cognitive, and organizational or macroergonomics. What a worker is doing at the physical level is influenced by their mind as well as how the whole workplace operates. That's the idea. Physical ergonomics would cover the anatomical, anthropometric, physiological domains, biomechanical characteristic. They relate to how our physical activity work. That include postures, manual handling, repetitive movement, workstation layout, and safety. That's the stuff we know. In the cognitive ergonomics, it includes manual process, perception, memory, reasoning, motor response. And if work itself is or thought process is monotonous, that is the cognitive ergonomic. Is there any interaction with other humans? Are there interaction with other machines like computers? Organizational ergonomics that include interacting with other structure, policy, and processes. We have to think about that. As a result of ergonomic hazard, the main issue or condition is musculoskeletal disorder and other condition as well. Musculoskeletal disorder or MSD is an injury, damage, or disorder of the musculoskeletal system that may include muscle, tendons, ligaments, nerves, joints, cartilage, bones, or localized blood circulation. And in terms of work health and safety sense, MSD can be acute or result of cumulative exposure. There is another term called hazardous manual task. So that mention about a task that require a person to lift, lower, push, pull, carry, or otherwise move, hold or restrain a person, animal, or the thing involves one or more of the following, such as repetitive or sustained force, high or sudden force, repetitive movement, sustained or awkward posture, and exposure to vibrations. So they are more of a background theoretical stuff. What are the main risk factors of ergonomics? We can think as a direct risk factor and indirect. Direct is the physical biomechanical risk factor, and that is, I'm basing this based on the hazardous manual task code of practice book. The main five are repetitive or sustained force. Force applied repetitively or held for a period. If you are using a stapling or using a trigger grip tool, for example. If there is high or sudden force involved, and above what most people would consider comfortable effort. Now there is no set number because that can be vary to individual person as well as acclimatize or train. Repetitive movement. If the same body parts need to move the same way repetitively, more than twice in a minute. Generally speaking, if there is sustained or awkward posture, held for more than 30 seconds, or outside of natural, neutral human posture. If we are thinking about trunk forward flexion more than 20 degree, and if we are looking at our neck more than 20 degree, and that seems very uncomfortable. Arm above shoulder, squatting, and exposure to vibrations is the fifth core risk factor. These risk factors, where do they come from? We need to know. That will help us or you to identify during your worksite visit. Where do you get ergonomic hazard? It arises due to work area and design layout, and the size, nature, and weight and number of loads or cargoes they need to operate, system or work, do they need to be working really fast, and rest breaks. What are the KPI? Environmental condition? Are there heat, cold, vibration, lighting, noise? Tools that they use, hand tool design, chair, keyboard, mouse, trolley wheels, or the tram controller, worker characteristic. That's not really part of the employer responsibility, but at the same time, the previous, let's say someone had previous injuries or higher BMI, or someone with poor or like spine condition, they may be increased risk of ergonomic exposure. So these are the direct issues. So what are the indirect contributors? As usual, we know psychosocial hazards. Psychosocial hazards modify our biomechanical risk through increasing muscle tension, not enough time for recovery, and alter pain perception, especially if there is a poor relation with the employer or colleagues, and reduce adherence to safe work, not because they may not want to or they may not empower to overcome these barriers. So the main key domains with the psychosocial factor may include job demand, such as high workload, time pressure, emotional demands, low job control, pace, order, and methods. Machine is telling you to keep up with the pace. Poor support is the supervisor at all. Poor workplace relationship, conflict, bullying, harassment, and low role clarity and role conflict. And finally, poor organizational change management, and if there are no good reward structure such as that. And what sort of health effects would we experience? Generally, we would experience on the upper limb is a common scenarios and common things we see. Conditions like carpal tunnel syndrome, lateral epicondylitis, rotator or shoulder problem, almost everything we see in the clinic. Decoy veins, ham arm vibration syndromes, or non-specific upper arms pain syndromes. In the neck and back, non-specific low back pain, disc herniation could happen from vibration, annular ligament tears, and whole body, so vibration again, the exposure to prolonged sitting, and that's also not good either for your long-term health. Cognitive-wise, over the time, it can increase psychological strain, and that has negative impact on other physical health aspects. Mental fatigue, burnout could happen. How do we evaluate these ergonomic hazards? Well, we need to go to workplaces first, not from reading a book for sure. When we get there, we need to get to know where the workers are, what do they do, what are the nature of the business, and what are the injury data looks like. And that will tell us your leading and lagging indicators. You can look at that, and that's something you can do before you get to the place. And you can also speak to individual parties involved, or when you get to there, take your time to speak to different people. And you observe the task work cycle, how do people do the job, how much force they need to apply, and you do measurement when you need to. If you have well trained for ergonomic measurement, that will be where you take out your tools from your bag and you start measuring, and make sure the findings are representative of the majority of the hazard that exposed, and we have to interpret that in the context of everything. Once we know, we can recommend controls. There are many other ergonomic tools that we can look at it. I have in my notes, well, I won't go through with that. And what are the controls that are useful or what we should know about? The first thing is that if we eliminate the process, and then that's it, automate the process and don't let people do these tasks. That seems like a simple solution, but it may also have other unintended consequences. However, there are parts where that are known to have high risk of injuries, that particular task should be done by something else other than humans. Substitution is that replacing the lower risk activity instead of higher risk as engineering control. So this is where most of the industry should focus on, or focusing I should say. And if you go to the show or the OHS or Work Health and Safety Roadshow, there's so many designs or engineering tools to alleviate ergonomic hazards. Some of them are quite good, some of them are not so good. The key thing is that when we are talking about ergonomic hazard risk assessment and control, controlling them alone don't address the problem. We need to address psychosocial hazard as well. if we don't address that, everything in the engineering won't make much difference. So it starts with a height adjustable bench, scissor lift, a trolley with the better control, grip, anti-vibration tools or gloves, and the administrative control is that how work is done. So work organization, that's important, and PPE is the lowest hierarchy in ergonomic risk. Obviously, it is not effective by itself. One thing I haven't mentioned before in the administration is the lifting technique training. If someone mentioned that we need to instruct the worker to do correct lifting technique, well, that may well be useful, but that may not solve all the problems that the worker has. And that's all I have to say about ergonomic hazard. That's a quick recap on what I have, and I hope you find useful, and I will get back to radiation. I promise.